Ms. Rempel Garner. Ms. Rempel Garner.
Thank you, Mr. Speaker. It's been suggested that Canada's government has been providing advice to Canadians based at least in part upon appeasing the WHO and in turn the government of China. Would this be an accurate characterization?
The Honourable Minister.
Sorry, Mr. Speaker, I struggled to unmute myself. This would absolutely not be an accurate characterization.
Ms. Rempel Garner.
That leads into my next line of questions very well. How many lost Canadian lives and jobs can be attributed to the government believing the following statement made by the WHO in January? There's no clear evidence of human-to-human transmission of the novel coronavirus.
The Honourable Minister. The Honourable Minister.
Sorry, I also was struggling to unmute myself. Well, thank you. As the member knows, this is a global pandemic, and the World Health Organization has played an important role in helping convene scientists and researchers from around the world to understand the science as it evolves around this novel coronavirus.
We'll go back to Ms. Rempel Garner. Ms. Rempel Garner.
How many lost lives and Canadian jobs can be attributed to Dr. Tam stating in January, quote, "It's going to be rare"?
The Honourable Minister.
Thank you, Mr. Speaker. As the member knows, we have been monitoring the coronavirus since we first found out about a cluster of unusual cases in Wuhan in December. At every step of the way, we've been
back to Ms. Rempel Garner.
About the risk to their health and safety.
How many lost Canadian lives and jobs can be attributed to the minister's opinion that, quote, border measures are highly ineffective, or that, quote, border measures don't work at all in March?
The Honourable Minister.
Well, thank you very much, Mr. Speaker. And in fact, we've had measures at the border since
I think we're done for now. Is that?
I'm sorry, there was an interruption there. Somebody had their mute off. The Honourable Minister.
Thank you. As I was saying, Mr. Speaker, to allege that there have been no border measures is actually untrue and misleading to Canadians. In fact, we've been screening arrivals at the international borders for quite some time, as the member knows.
Okay, go back to Ms. Rempel Garner.
I simply quoted what the minister said, so I think she just said that she was misleading Canadians. But how many Canadians' lives and jobs can be attributed that were lost can be attributed to the following statement from the minister? The risk is extremely low for Canadians. There's no need for Canadians to be alarmed.
The Honourable Minister.
As the member knows, the risk assessment that we were providing Canadians at every step of the way was posed on the actual risk to Canadians at that time. And as the risk changed to Canadians, of course, so did our assessment and so did our advice.
Ms. Rempel Garner.
Does the minister consider the statement, "If we all stop moving for 2 weeks, the virus will die," to be COVID misinformation?
The Honourable Minister.
Well, thank you very much, Mr. Speaker. And in fact, we know that one of the ways that the virus is transmitted is, in fact, people having close contact with others. And I would argue that there is still quite a bit of work to do to remind Canadians that as we loosen our economy, we need to continue to physically distance.
When the minister stated, "It's unfortunate that misinformation is creating a perception for Canadians that belies reality" at a press conference, was she referring to the advice coming from her, the Prime Minister, and Dr. Tam?
The Honourable Minister.
Well, thank you, Mr. Speaker. The effects of the pandemic have had significant impacts on different groups of people in different ways. And I recall that particular conversation, in fact, and was talking about the particular effects on the Chinese Canadian community that was suffering from a high degree of racism.
Thank you, Mr. Chair. Given the literal failure of the government, fatal failure of the government to provide timely, sound advice to Canadians on COVID-19, would it be fair to say that Canadians should think twice before blindly placing their trust in this government when it comes to measures that take away their civil liberties, safety, and livelihoods?
The Honourable Minister.
Well, thank you, Mr. Speaker. And it's an interesting line of questioning the members pursuing. In fact, what's kept Canadians safe is Canadians listening to the advice of public health officials across the country who have been advising them every step of the way how to protect themselves and their families. And I want to thank Canadians for the extreme work that they've been doing to prevent the overwhelming of our healthcare system that we've seen in so many other jurisdictions.
We'll go back to Ms. Rempel Garner. Ms. Rempel Garner.
Does the minister support an unimpeded, full, independent global investigation into the origins of the coronavirus?
The Honourable Minister.
Thank you, Mr. Speaker. As the Prime Minister and I and many others from this government have stated, there is an imperative that we have a review not only of the international response to the outbreak of COVID-19, but our own country's response. It's going to be a very important way for future generations to learn how to combat global disease.